So good afternoon. It's with pleasure that I'm participating in this webinar, which has been organized by Glass Academy on the occasion of Toilet Day. So I'm Pratima Joshi, and I'm representing Shelter Associates, an organization founded in 1994 by architects and planners. I'm a founding member and have been working full-time over the last 27 years in shelter. And sanitation has been very, very close to our hearts. So it gives me added pleasure to be talking about our sanitation experiences over the last decade and a half. So a little bit more about the organization before I continue. We started this with the vision that we wanted the urban poor living in informal settlements to pursue their rights to dignity and have an elevated quality of life. And so we pursued this through our mission, where every citizen has access to basic infrastructure and secure tenure. So today, as the organization stands, we have a mix of all kinds of people who work with us. We have architects, of course. We have social workers, we have people from the slums who do full-time work with us. And we also have a specialized team of data people like GIS experts and M&E experts. And of course, a very, very steady stream of volunteers who have added a lot of value to our work over the years. I'm also very happy to say that we have had our fair share of awards and recognitions coming to us over the years. Just naming a few, we are the only Google Earth hero who have been awarded that in India in 2009. We have won several accolades for our data-driven approach to planning, and some of that includes the HUDCO Award, the NASCOM Award, the FICCI Award. And very recently, just this year, very early this year, we got the good news that we were also the recipient of the LPC Honor Award at the UN Habitat World Urban Forum at Abu Dhabi. So why sanitation is what many people ask me. And I tell them that we didn't start out thinking that we would be doing sanitation, but as we started gathering data about the poor, and the city where we began our journey was Pune, which is where we all lived. I still continue to live. So it has really been our karma bhumi, as I keep joking. Whatever you try out in Pune and export it anywhere else works, because Pune is a fairly tough city to get things going. So when we did our first data, as I say, poverty mapping using GIS technology in the late 90s in the city of Pune, one of the things that hit us the hardest when we analyzed data for nearly 2/3 of Pune's slum was that sanitation was a very, very big missing piece, access to safe sanitation. The people were much better off when it came to electricity, when it came to water, but most of them were very badly off when it came to having access to safe sanitation. And this seemed to be the story across the cities of Maharashtra, wherever we stepped in and started working, and of course, putting data in place first. So then we decided that it was well worth, stepping into the sanitation sector and seeing what we can do here. So, as things stand, I thought it will be good for me to at least flag some of the major issues that people face when they don't have access to safe sanitation. I know a lot of you are aware of the issues and the difficulties people face, but I thought, let me just reiterate them. We have waterborne diseases contributing to nearly 100,000 diarrheal deaths of children under. The fear of sexual assault, need for privacy, and unusable state of facilities. Often, in one of the studies, lead to women sometimes holding their bladder as long as 13 hours a day. none of our community toilets facilities or even public toilet facilities have any thought given to how disabled people can use it. Many young girls, whenever we worked on our one home, one toilet model in slums successfully, the first reaction of young girls is that, now we can eat to our heart's content, which actually speaks volumes of what they must have gone through, especially when they had to skip a meal in the evening or skip drinking water late in the evening, just for the fear of having to use a toilet after certain hours. So it is a very, very difficult situation out there. And so we decided, let's do something about it. But since today's session was more on public toilets, we haven't, I'll say at the outset, we haven't really worked as much on public toilets as we've done on community toilets, or worked in slums related to their sanitation. But we had the opportunity of working with the Panvel Municipal Corporation a couple of years ago. And we, of course, started off working in the slums of Panvel. But we had a very special request from the Panvel Municipal Corporation saying that we really would appreciate if you could undertake the survey of all our public toilets across the city, just as you will be covering all the slum data across the city. And we decided that we could sort of extend ourselves a little bit on that. The findings were fairly startling. There are 54 slum communities, and across those 54 slum communities, you have community toilet blocks, which are 56 in numbers. And you have public toilet blocks across the city of Panvel Municipal Corporation, which are about 225. And there are, of course, a few public toilets. There are 10 of them which are attached to petrol pumps, and the petrol pump owners actually keep them clean. So they are looking after them. So these were all the CTBs and public toilet blocks that we surveyed. And what and our survey findings was that a lot of things needed to be addressed. One was that availability of water was really, really poor. I mean, imagine 244 toilet blocks had no access to water. There were 14 which had barely, water coming in for 2 hours, and the others were really, really abysmal. So that was one of the things that hit you the hardest. The second thing, which also was very discouraging, was the fact that there was hardly any light in toilet blocks after dark. So 219 toilet blocks did not have access to electricity and hence no light. And which meant that in the dark, most of them were not usable. And the other thing which we found very strange was that they were called public toilet blocks, but there were sometimes, there were 78 so-called public toilets, which were less than 4 seats, like 2 to 4 seats. Do you call that a public toilet? Or, another 78, which was less than 6 seats. So if you put these figures together, you have almost 50% of the so-called public toilets in Panvel Municipal Corporation, which were really so tiny, very difficult to give them, to maintain and manage them. So a few photographs of the so-called public toilets. And as you can see that, they're very, very poorly maintained. So when we were talking to the municipal corporation and we were sharing this data, we, asked them to take a real hard look before they really strategize anything in terms of refurbishments or, rebuilding any of those. At the same time, we also looked at the community toilets that were being used. I want to, at this point, let people know that across cities in India, the only solution that has been given to the poor is community toilets. Cities have never really bothered to dive deep to see if there could have been another option. And so what you end up giving the poor are community toilet blocks, which are often very poorly maintained, which crumble within a few years of being built. And it's a constant investment in terms of finances. It's I call it a white elephant, because every year every city is spending crores of rupees in just upkeep and maintenance and repairs, and sometimes rebuilding these community toilet blocks. So the situation wasn't very different in Panvel Municipal Corporation either. There were, what was strange was there were 53 slums, and only 33 slums had access to a community toilet block, because 18 of them had no access to a CTB. There were none. And there were only two slums which did not have a CTB but had an access to a public toilet block, which was just outside their slums. So when we took a look at what was the situation in those existing 54 CTBs, we found that out of 54 functional CTBs, not all the seats were functional. The toilet to person ratio was 1:13 families, so which obviously is not a desirable ratio. One would say max 1:4, 1:5 is a good ratio. So obviously those CTBs had a lot of pressure. But 49 of those CTBs, 54 functional CTBs, did not have a caretaker. 40 of them did not have electricity, and the frequency of cleaning was abysmal. I mean, there were only 9 CTBs which were being cleaned every day. Most of them were on alternate days, like 25 CTBs, and there were 20 which were cleaned less than twice a week. So you had a fairly dismal situation here. We also did a buffer analysis to see for every square kilometer, if there were a public toilet across the city that could be used. And we found that, while some had none, in some there were too many of them coming together. And these were really tiny, tiny so-called public toilets, which were, and none of them really working well. I just want to point out here that the public toilet maintenance has been outsourced by the municipal corporation to a private agency. And the agency comes in every day, once a day, and they just clean out the toilets, and then they leave. Then for the rest of the day, because there is hardly any water supply, people really can't use them. They're not usable because anybody who's using them has no access to water. And so when he leaves, the toilet is unclean for the next person to. So the major challenge for the municipal corporation really is to try and get now water coming in to their public toilets before they even go further and invest in rebuilding them. So we came out with a whole set of parameters. There were 18 of them, through which we did a vulnerability index and scoring system. We came out with we studied those parameters, and then we came out with a whole scoring and a rating system. And more than 60% had extremely poor ratings. In the first phase of trying to do something around public toilets, the municipal corporation had come out with, they'd identified 28 public toilets, which they needed to, which they had almost decided to start working on, and they had funds allocated for it. And when they saw that we had done such extensive study, they said, why don't you please take a look and see if we are on the right track? So we went there, looked at all the 28 location, and then we were able to get back to them, telling them that out of 28, 50% of them were not even required. And that meant a saving of almost 2.24 crores for the municipal corporation. So what I believe really project around sanitation or even any other sector, you need to do a study of the neighborhood also, because we also found that sometimes there were some public toilets which were just catering to communities, slum communities, which were very close by. And in a couple of instances, we were able to point out to the municipal corporation that if you didn't spend so much on the public toilets, which would become very difficult for you to maintain later on, and invested that money in giving every house a toilet in the community, you would be much better off, because you would have actually created a very sustainable solution and rid the community of the dependence on a CTB or a public toilet for their daily use. So of course, so across cities, I always say that you have to look at, whenever you're thinking of putting in a public facility, you must do a neighborhood study to see who's going to use it, what is going to be your footfall, do you have adequate water, electricity, are you going to be able to maintain it? Because building a block is the easiest, but the subsequent maintenance is something that you really need to focus. Are you going to be able to have a caretaker's facility or build in systems which will ensure that they're clean and usable? Maybe you need to look at a pay and use model which makes it self-sustainable. And wherever possible, try and see if there are other solutions that can be explored. And of course, last but not the least, please ensure that they can be used by the physically disabled and the elderly whenever you have these facilities given. So now I would like to just sort of come to, so, okay, it's fine to have done all these studies, but how have we actually used it in terms of delivering a facility like sanitation on the ground? So this is where I would like to talk a little bit about our one home, one toilet model, which we launched just before Swachh Bharat Abhiyan was launched, about a year prior to that. It's I would say, a three-pillar model. The first pillar is, of course, data. We are an extremely data-driven organization, as you must have realized. We believe in making sure that we have good, usable spatial data in place before we embark onto any project. And so that really helps you. It gives you a great amount of clarity as to what are the problems, which are the pain points that you need to address, what is the situation on the ground, what kind of solutions might be possible, and then with participation of everyone, all the stakeholders, you then decide what would be most appropriate out of the menu of options that you may have. The second pillar of our model is mobilizing communities, and we absolutely believe that the communities must be central to any project that you engage in. Unless they are engaged, unless they own it, unless they are fully involved in that process, you're never going to end up with anything that is sustainable. And thirdly, we believe that there should not be any freebies to anyone. Everybody should even financially contribute. So it's not just the government which contributes in terms of laying drainage networks wherever possible, or repairing the lines wherever needed. It's also the community which has contributed financially in this. So the beneficiary families have borne the cost of construction of that toilet. And on behalf of Shelter Associates, we've raised funding through CSR and made materials that they would require for constructing their toilet available at their doorstep. So that's how the entire cost sharing model has worked. And just to give a little bit of information about the impact we've created so far, we've worked in 7 cities of Maharashtra, which you can see: Pune, Kolhapur, Thane, Navi Mumbai, Pimpri Chinchwad, Panvel, and Sangali. And we have covered close to 3 lakh households across several slums. And we have directly impacted 21,000 families with our one home, one toilet model, which means that we've reached out to over 1 lakh people directly with the home toilet. So as I said, we are very data driven. And so how have we used data? We have used Google Earth as a base map for mapping every house and every amenity that exists in a slum. We have used Android-based systems for capturing household data. There are open source tools that we've used for that. And of course, we use the entire GIS technology to integrate all the mapping and data information so that we can query it and come out with proper strategies for planning. So how do we do this? We do this in partnership with the urban local bodies, where we have them completely clued into the process. So the data that is done is validated by the urban local bodies. Get them to validate it. We also undertake training for all their engineers and sanitary inspectors, I mean, across the cross section of bureaucracy, so that they understand how to use that data, how to leverage it, how to use it for monitoring and tracking. And that is something that we feel gives them that confidence, and helps them also understand the ground situation much better. So we co-create data with urban local body, and of course we co-create data with communities, because I have always said that if community members can be involved in data creation, then you can be sure that the quality of data that you get is much better than when you get people from outside coming in and doing the surveys. So communities help wherever they can. We share this data again with them so that they also know very clearly where they stand in terms of access to different kinds of amenities, like maybe water or sanitation or electricity. And also, whenever we do mobilization activities, we ensure that this data gets used very extensively. So I just want to show you some of the impact that we have had at slum level across different cities. This is Panvel. If you look at one of the slums there called Panchashil Nagar, pre-intervention, they had a toilet seat to family ratio which was like 1:27, which was really very high. All those houses in blue were using community toilet blocks. There were hardly people with household toilets. It was just barely 1%. I'm sorry, 18% families who had a household toilet. By the time we had finished our intervention, from 18%, it went to 59% families now having household toilets. And that reduced the ratio from 1:27 to 1:15. It still needs to be better, but there has obviously been less stress on the CTBs ever since we've implemented this program. So how do we leverage the slum maps to give to run this one home one toilet program? So the important thing is that you have to understand how the drainage networks are laid. Are there any networks in the first place? And if the networks are there, are they blocked? Are they in use? Do they have adequate carrying capacity? Typically, in a slum, you might have more than one community toilet block. So what are the differing pressures on them? Sometimes, you find that if there are 4 or 5 or 9, in this particular slum, there are 9 community toilet blocks, but the pressure on each CTB is varying. And it's good to know that, because then you want to see if there are ways in which you can reduce the pressure where it's too high, and you can sort of, equalize it maybe. Then you also know, when you look at the lines, which are the lines which need to be cleaned out maybe, or which are the lines which need to be replaced. So we go into such detail. So we work with the ward office on an everyday basis. So this is the way the ward officers know which are those lines. Maybe the ones in blue need to be changed. Maybe the ones in brown just need to be cleaned out. And again, if you're looking to impact, specifically maybe the old or adolescent girls, like the girl child was something that most of our donors wanted to ensure that their program reached to. If you look at this particular settlement, which is one of the biggest in Pimpri-Chinchwad, we were able to, of all the toilets that were given, that was over 1,700 toilets, the ones with the hatch were all the houses where there was a girl child under the age of 18. So you can really ensure that you reach the targeted, population, when, especially if that's one of the mandates. And even in this, we had a toilet to person ratio, which was like 1:102. There were very few CTBs pre-interventions, and post-intervention, it has gone down to 1:24. So for every seat, you have 24 people, which I think is fabulous, which means it's about 4 families to a toilet, which is a much better ratio than what it used to be. From the government's perspective, it makes it very easy for them to plan. It's not like they have all the money to put in immediately. Since they don't have information at all, it's very difficult for them to plan drainage networks. So if they have to budget for it, then they can do it in phases. So for instance, in this particular slum in Navi Mumbai, we did this program across 2 years. So the first year we just targeted the families which were, which had access to an existing drainage network. But in year two, we were able to target the remaining families, because by then the municipal corporation had time to budget, float their tenders, issue work orders, and make sure that the lines that could be laid were laid. So then it prepared us to enter phase two. So it really allows you to phase out the work and plan for it in a very systematic manner. As I said, we also use it a lot for doing our mobilization activities. So in this particular settlement, we divided the settlement into pockets of 100 families. So that's where you see all those different colors. And for every pocket, we assigned a volunteer from the community who ensured that, who was trained, of course, by our teams to run various programs related to WASH across the cross section of his pocket. So right from children to the youth, to the women, to the elderly, the volunteer was able to reach out with various very focused modules that we had trained them to run. And this came in really handy during COVID. Because in Pune especially, there was a huge outbreak of COVID in slum. And so we had a very focused program where we encourage hand wash, use of sanitizers, where we also, with UNICEF, install pedal push hand wash stations in or outside community toilet block. So there was a lot of mobilization that needed to be done. And so we used these maps very effectively to do that. So this is all at one level, which brings in a lot of transparency. But at the other level, at the city level, we have ensured that the data on slums has been brought into public domain. So today, if you look at the cities where we worked, they have linked their website to our website wherever their data has been put out. So bringing this entire data, made available to a much wider audience. So this is Kolhapur Municipal Corporation. This is the homepage of their website, and you can see the Shelter Associates logo. If you click on it, you get immediately linked to the slum data of Kolhapur. And our donors have also been fairly happy, because for every toilet that they have donated, they have a fact sheet for it, and it's online, so they can look at the household in a particular slum where they've donated. Click on that house, and there's a basic information which comes out with the photograph of the built toilet. So this brings in a lot of transparency for them. It brings in a lot of trust. We encourage them to go and visit these families without us, so that they also can see if that facility has really reached the intended families. And just to give you what has been the impact across cities that we worked, which we are very happy to share with everyone now is, look at Pimpri-Chinchwad. Pimpri-Chinchwad, the drainage network coverage has gone up from a mere 37% to 68% in slum. But the percentage of home toilets has increased from 11% to 57%. In the city of Pune, it was an exceptional situation, because they had drainage networks and the city was not aware of it. The percentage of people now in slums who did not have a toilet, from 28%, it has gone up to 60%. In Kolhapur city, from 23% to 37%, the drainage network has gone up, and the coverage has been stupendous. From 25%, it has gone up to 67%. So 67% of Kolhapur's poor today have access to a home toilet. And it's the same story in the other cities too. So there has been a huge investment by urban local bodies. I mean, across these cities alone, we've got an investment of almost 47 crores that has been put in by the cities. I also always keep telling people that, how important it is to do data, and this kind of data is less than 2% of what it actually leverages at the end of it. So it is not so expensive, and it is absolutely worth it. And these are some of the photographs of the finished toilets. And I'm sure you can see that every toilet is looking different. And every toilet is looking different because everybody has had the freedom to build it just the way they wanted it. Everybody had the freedom to choose the kind of finishes they wanted. No, we haven't paid for any of those for those tiles or those fancy taps or anything. All of that was bought by the family themselves. So, as I keep telling people, people went well beyond just bearing the cost of construction. They've actually invested quite a bit in their finishes, and they take a lot of pride in their toilets. And one of the very important things that people might like to know is that 40% of families who have availed of this one home, one toilet program have actually taken the trouble of either partially or fully upgrading their homes. So a thing like a toilet, a facility like a toilet has actually triggered a lot of home improvement across cities. This is not just one or two cities, it's across cities that we have been able to see this happening. And I would just like to end with a very short impact film that we put together for one of the slums in Panvel where we worked.
जेंट्स का टॉयलेट्स और लेडीज का होता है यहाँ पे सार्वजनिक। इसके अलावा हम लोग अगर जेंट्स में जाए या लेडीज में जाए तो थोड़ी एक मतलब लोग ऐसे ऐसे देखते हैं कि जैसे मतलब एक अचानक से हम मतलब वो क्या बोलना चाहते हैं, हम कुछ बोलना चाहते हैं, मतलब हमको देख के एकदम पीछे हटना, उनका मतलब उनका बिहेवियर थोड़ा अलग टाइप का होता था।
आम्हाला बाथरूम नव्हते त्यामुळे आम्हाला या साईडला यायला लागायचं। आता सध्याच्या पत्रीनं जेव्हा आम्हाला रेल्वेच्या अलीकडे बसायला लागायचं झाडामुळे, आणि जागा नसल्यामुळे आम्हाला इथंच यावं लागायचं। म्हणजे मजबूरी होती आमच्यावर जागा नसल्यामुळे, आणि काही लोक आमच्या मजबुरीचा फायदा घ्यायचे।
बाहर हम लोग जाएं तो मतलब एक टाइम खराब होना, जैसे स्टेशन वगैरह पे जाना, स्टेशन पे करके फिर जाना, फिर वो एक अलग हो गया कि हम पनवेल स्टेशन पे जाएं और हमारे बाजू में बाथरूम है कि वहाँ पे लोगों का देखने का नज़रिया, देखने का जो स्टाइल था उनका, जो है बात करने का, तो वो अलग था एकदम। तो हम लोग यहाँ पे अपने हमारे घर में शौचालय बना है ये, तो एक ऐसी मतलब प्रॉब्लम सॉल्व हो गई है कि हम लोग को बाहर भी नहीं जाना पड़ेगा, हमने अपने आप को जोकर भी नहीं बनाना पड़ेगा।
From my end, thank you so much for watching this, and I'll be very happy to field any questions.
You can start, ma'am.
Yeah. Thank you, Architect Pratima. That was a great session. It really brought into perspective the need for research and inspiration in the Public Works Department. The work that the Shelter Association has done and the change it has brought about is heartening to see. This presentation has underlined the impact a single toilet can have on its surroundings, how it can completely transform spaces and lives. I'm sure the attendees share the sentiment. We have a few questions waiting for us in the chat box. So without any further ado, I will start the Q&A session. The first question is by Bhavna. How was your experience working with the municipal corporation and other government bodies?
Actually, very good, especially when it comes to the One Home, One Toilet project. We've worked in 7 cities, and without exception, I would say that every city has gone all out to support this project. I think one of the reasons for that was also because it was very well aligned with the national policy of Swachh Bharat Abhiyan, and every city needed to show results. So it was very much in their interest to support this project. Also, I think sanitation has been hugely neglected over the years, especially urban sanitation. And this was an opportunity that almost every city grabbed, to ensure that the slum dwellers benefited with this program. And as you can see in the presentation, the impact was pretty huge in some of the cities like Kolhapur, from being barely 24-25%, it has gone up to 66% of household sanitation coverage. So what I think most of the government people liked about this entire process was the kind of transparency it also brought in. It gave them very precise, snapshot of what needed to be done on the ground. See, when you have good ground data, then it's much easier for the city managers to take decisions. And I think because data aided this whole decision making, helped them plan, helped them budget, I think we were able to achieve that kind of impact. And the second thing is, I always tell people that if you don't have a financial agreement with the government, and if it is mostly as an enabler that you partner with them, the chances of working with them is much, much higher than if you were to have a sort of a financial agreement with them. That can be troublesome sometimes. So we completely avoided that.
That is very insightful and very interesting. And I think you've also answered the next question by Arman Malik, who asked about, how has Prime Minister Modi's Swachh Bharat movement impacted your initiative of One Home, One Toilet in terms of public and government response? So, yeah, I think you've already
kind of answered that. I have answered that, but I certainly want to reiterate the fact that, because Modi ji brought this center stage, it got the impetus that I've seen in the last 5 years. Otherwise, we have been working in the sanitation sector since 2001, and never has there been so much interest around sanitation and cities' willingness to do anything. So I would give full marks to the Prime Minister for, really pushing this and making this a flagship project.
That is wonderful. That is indeed wonderful. And yes, even we have observed, the stigma and the shame that used to surround this topic, it has considerably, I feel, come down, at least, a matter of a few percentages in the past few years.
Absolutely. There's so much talk about menstrual hygiene and, all kinds of things which were taboo earlier. And in slum settlements where we do our mobilization activities, we find that the women, the young girls, all of them are so forthcoming in sharing their experiences, because now it is being really discussed and debated. And I think that is so important, that people get over these inhibitions which have always been around these kind of topics. So that certainly has helped people open up. This intense, I think, movement on the ground has certainly impacted that too.
Absolutely, absolutely. On that note, there is a statement by Kavya Valsraj, and I'll quote her verbatim. Not a question, but I feel it is incredibly commendable that you have considered issues of abuse, molestation, and safety while collecting data and designing, which I personally also completely agree with.
Yes. So
This is great
I'm glad you've appreciated that, because these are, not really very easy to sort of initiate in settlements. You need to build a relationship with people before they start opening up on this and sharing their experiences. And I would give full marks to our teams on the ground who have really gone all out and drawn responses and then effectively tried to address them. So thank you so much.
Yes. So moving on to the next question by Kailash Jain. You talked about different toilet models. In a slum, where would you recommend CTB individual toilets and a pay-per-use versus a free model?
I didn't understand. What was the last thing? I didn't get that.
So he's asking that you talked about different types of models, right? And then you also said that, in a slum, they should consider giving individual toilets to certain houses. But then in some places, a CTB is more appropriate. So he's asking that where would you recommend installing a CTB versus individual house toilets? And where would you recommend having a pay-per-use model and versus a free model? Like a free-to-use model.
Okay. See, again, this would be completely dependent on what the data throws up. Like I think I mentioned in today's presentation that in a city like Panvel, there were some public toilets which were being more or less, exclusively being used by communities which were in the vicinity. Some communities, or maybe people living in Guntevari areas who are again in the very low income category. Now, when we realized that this is what was happening, we said, why do you want to invest in such an expensive community toilet block or a public toilet block? Why don't you try and encourage people to take a home toilet, which would automatically be far more sustainable, which would rid the government of the need to even maintain it, because maintenance becomes a huge issue for every city at the end of the day. And at the end of the day, a public toilet is going to be sustainable only if it generates a certain revenue, which would be dependent on the footfall, right? So if you don't have adequate footfall, which was something that in Panvel they were facing, that they didn't get enough of a footfall for them to get the kind of revenue that would be required to have a caretaker in place and, an entire cleaning system in place. Now, if you have situations like that, then then it makes ample sense to go and reach out to the communities and try and promote a household toilet. In general, I don't even think there is a question about where you put a CTB and where you go for household toilet. My priority would be to give a household toilet to every house wherever possible. And that is what we have done. CTBs are anyway there. But as we have studied, the pressure on CTBs has been enormous in the last few decades. So we are saying that at least reduce that pressure to, as a first step. Give many people who are willing to take a toilet, a home toilet, wherever possible. Where it was not possible to connect it to drainage networks, like in a city like Kolhapur, we've actually done home toilets with septic tanks and sometimes connecting it to biogas plants and whatnot. So we've also experimented a little bit with alternate technology. So if there are 15 or 20% of families who get left out, who cannot take a toilet for whatever reason, and have to depend on a CTB, reduce the toilet to person ratio to such an extent that you can divide the seats between the users and again rid the government of the maintenance burden. Where you can charge pay and use, I think, is largely public toilets, because the public toilet doesn't cater to one community necessarily. It has varied kind of footfalls coming from various people, and you need to generate a revenue for that, for it to be clean and sustainable over a period of time. So I think the study would really give you a good idea of where you need what kind of a combination. It would be very difficult for me to just offhand say that for any city. Or generalize it. It will be completely data-driven, the decisions that come out.
Very true, ma'am. Very relevant and much needed also. And this has actually given a great segue for the next question by Prakriti, who asks that how often is maintenance carried out, and does the organization, Shelter Associates, retain any role in the working of public toilets after completion and handover?
Well, actually, we don't do public toilets at all. We don't do community toilets at all. We have only been working on home toilets. But because of COVID, pandemic and all the wash-related issues that came up during the pandemic, where people, those families who needed to still use a CTB and were very frightened, and of course they were not very safe. That's when we got involved, and we tried to set up systems which would ease that process and make it safer. But our entire work has been around promoting household toilets, and that is what we have been doing. We have not really undertaken construction of any public toilet or community toilet block under the Swachh Bharat Abhiyan.
Okay. So I'll answer the question, Prakriti. And so when we are talking about data, Sandhya is curious about what parameters should be considered while doing a sanitation neighborhood study, and what is your process and what tools are essential.
So when we did data, we were very clear that it was going to be kind of there were two kinds of data that we collected, obviously. One was at the, mapping the infrastructure that existed in the settlement, because we needed to know what kind of lines were there, what kind of infrastructure was existing, what kind of water facilities were there, because you can't do sanitation without water. So mapping infrastructure was something that we did at one level. The second thing we knew, we wanted to do a rapid household survey through every house, because there was some basic set of questions that we needed to have answers to, like, do they have water at home, water connection at home? Do they have a toilet at home? If not, which CTB they use? Or if not CTB, are they defecating in the open? What are they doing with that? With the defecation part of it. And then also solid waste management. These were some of the things that we wanted answers from every family, because when we ran spatial queries, we immediately could then pinpoint houses which did not have a toilet, and and the houses which said that, yes, we want a toilet at home, because that was one of the questions that we asked, do you want a toilet at home? And across cities, more than 70% families said, yes, we want a toilet. And I think that completely blew the municipal corporations, because they had this mind block that people will never take a home toilet because their house is too small. So there was key questions, about 15 to 20, that we ran through every house. And that was the data combined with the infrastructure mapping that really gave us very, very clear insights into what were the possibilities and aspirations of the people around sanitation.
Absolutely, ma'am. Data collection, research, it is a very, very powerful tool. And it's very interesting to see the way that you have done it. So the next question is by Aditya Raj, who asks, what sustainable measures can architects incorporate in public toilets?
Okay. So this is one of the things that we were looking at, when we were doing Panvel study. And we said, some of the things that you absolutely cannot do without is, having adequate water, having a caretaker, having a caretaker facility, making sure that, the toilets are usable even for the handicapped people, making sure that, you have certain facilities for women especially, maybe a changing room or whatever. These are some elements that really need to be built into a public toilet. I don't think you can really compromise on some of these most essential things that I've just mentioned. And of course, you can keep adding to that. When we do community toilets, when we did that, I would say 15, 16 years ago in a few places in Pune and even in Sangli, this was community toilets I'm talking about. We actually even added a small section for the small children, who are under 5 years of age. there was a channel that we built into it as an architect, because we realized that small children cannot use a big, a toilet meant for an adult. They can't even squat on that pan. So we had a channel which was attached to the women's section of the CTD, and that made it so much easier, because the woman and the child would go together, and it would be so much easier for her to clean it if he or she was using that channel under her supervision. So these are some things that anyway one needs to take care of. Water availability is such a big need, and Panvel Municipal Corporation was absolutely lagging behind in that kind of requirement, which is just so basic. These are a few things which I think as architects we need to be, and as architects I would say we can go a step further and see, can we build recycling of water? Are there any other features that we can build in to make it attractive, to increase the footfall, make it safe? I just feel that, if we can add monitoring gadgets where people give feedback on, how was their experience in using a toilet. I mean, there's just no end to how much you can enhance, the quality of use. If you really apply yourself, there's just so many things now that are available in the market that you can also try and add value with.
Absolutely, I agree. And the way innovations are being looked at, green innovations, design innovations, it is very interesting. Like I remember, I think last year I'd gone to Kerala, and in the tourist places they had temporary toilet sheds. The ones that compose themselves. And there are so many different types of sanitation devices that we are seeing nowadays, and it's just very interesting to see, which Ayush is also quite curious about. But your view on permanent versus temporary toilet structures, what is a better alternative?
So this is again with respect to, I don't know if he's referring to mobile toilets, which sometimes you find dotting the city. If that is what he's talking about versus permanent, if I've understood that, then I would say they have their own uses and own needs. In Pune, they have tried out the mobile toilets where they've refurbished buses, old buses, and they're on wheels. And the whole idea was to very strategically place them in crowded marketplaces or areas where there were a lot of footfall and there were hardly any toilet facilities for women. I thought that was a great concept because it was very neatly executed. The first couple of them which came out as demo ones, I had a look at that and I thought they served a certain purpose. But some of the public toilets which are permanent in nature, of course, they just need to be there because the footfalls are so high. I think more or less in every city, the huge battle is that there aren't enough public toilet facilities. Even in a city like Pune, where there's so much of awareness and there have been public litigations against the government on the paucity of public toilets, we still don't have as many as we would like. So I think anything that would increase, the presence of toilets, access to toilets, whether it's through mobile toilets like the refurbished buses or permanent toilets, I think all of that is a must right now.
Absolutely. I've seen the buses that you've talked about, the she
buses, and I think they're very exclusively for women. And I think they've been very nicely done. I just wish there were many more of those dotting the city. I've hardly seen any of those in the recent past, but when they were out, I thought they really looked good. And I just hope that they're working out the management around it efficiently so that we get more and more of those.
Yes. There are quite a few. I agree with you. There are quite a few. Like the number's quite less, but at least those that are there are quite clean. So that is a huge step up, I feel, from the current scenario. So I think the next question we'll take will be the last one, which is by Shreya Mona Lisa. And she asks, isn't it an oxymoron that you're asking the community present in the slum to pay for basic services that everyone should have the right to, and why do they have to pay?
I mean, I'm not very clear about this question. Is she referring to the pay and use toilets where people have to pay for every use? Is that where she's coming from? Otherwise, any public toilets, of course, you pay and use, but a lot of CTBs are being used. What is the kind of thing that you pay? 30 rupees or 40 rupees per month for an entire family, which I think is almost like it being free, right? You also pay for a mobile phone. Most people have smartphones nowadays where you're paying more than 150 and 200 rupees. If you have to use a common toilet block because you don't have a toilet at home, to pay 30, 40 rupees a month, I don't think it's such a big deal, frankly. So I'm not very sure where that question is coming from, but there is a willingness to pay if the services are good. Even the poor are willing to pay for a good service. So
I think this was, related to the statement that you made that you don't believe in freebies.
That way. Okay. All right. So let me address that. Yes, we are very, very keen that there has to be a financial stake also, that every, it can be a small amount. It doesn't have to be very big. But it definitely is important to have a financial buy-in from the community also. Because we find that when people... I'll just tell you very simply that the fact that they have control over the toilets simply because they're paying for the cost of construction has given them so much freedom to, monitor the quality of work. I'll give you an example in Pune, where the municipal corporation went right ahead and gave free toilets to the community people under the Swachh Bharat Abhiyan. So what they did was they deployed contractors who went around, who bought the material, who got it constructed, and they just gave it to the people. And then they got reimbursed for the toilet that they had provided to the people, to the families. And there were so many issues with those toilets because people had no control. They could not monitor the quality. Sometimes the toilets were so small that only their children could use it because these people really made them so tiny, the contractors. And their attitude was, you're getting a freebie, you better take what you get. So, that is the danger in which the whole thing sort of starts going. You will be surprised that in a settlement where the contractors were also at work with the free model, many families opted for the shelter model because they said, no, we are okay with paying for the cost of construction, but we want to be able to have control over the quality and the kind of toilet that gets built. We want more control, and we are willing to pay for that. And at the end of the day, there have been people have not complained about the finish, the quality or anything because they had the freedom to build. And it's not a huge amount of money. If it was just building a decent toilet and just taking care of the cost of construction, it was anywhere between 6,000 to 7,000 per family, which is not a huge cost once the materials were coming in free. And I don't think the poor really grudged that amount. They were more than happy to pay for that.
Okay. I hope that answers your question. And so, ma'am, Geeta ma'am is also here in the chat. She has also been listening into the webinar. And she says, and I quote, Pratima, so happy to have you as a resource person. Could not think of anyone more apt. Someone who walks the talk. Listening to you always evokes nostalgia for me.
Thank you so much, Geeta. And I just love the new courses that you're running for the school children. I thought that was such a great idea. I mean, you are always doing such inspiring things yourself. So great. I'm glad you thought of me.
Yes, ma'am. She also says that many students and young architects are here. It would be good for them to hear your advice on transcending your role of the conventional architect, allowing the role to embrace social issues seamlessly.
I'll be honest. I never really went into commercial architecture, so I've never had to do anything seamlessly from one to the other. I was very focused when I did my architecture, even when I was doing my bachelor's degree, that I wanted to do something in alternate energy. I started out with that, and then I decided that no, then that progressed into something that caught my eye and made me very passionate about was work in the development sector and in the urban development sector. So as an architect who, also then came back to Pune after marriage and started working with Center for Development Studies and Activities, that gave me a lot of exposure to the problems of development, and I just found it very exciting. And I would only urge the young budding architects that at least give it a shot. If you get an opportunity to work with any of the architects who are working in the development sectors, at least see if you can do a short stint with them. It would be such an eye-opener for many of them, and it would be so exciting also because there's just so much that needs to be done. There's so much scope for architects really to be out there. And it of course requires a lot of patience. You need to have patience. You need to have commitment and dedication. But that you would need anywhere you went. But the kind of satisfaction you get at the end of the day, I've been to kind of many toilets, more than maybe housing. But every toilet has given me a huge amount of satisfaction knowing the immense value that it has added, the immense enhancement into their day-to-day living that it has brought. And the relief, like today, when you from barely 30% household toilet coverage in the last 4 months, it has gone up to 65%. Wow. And you should have seen the way people participated in decorating their toilets. We actually had a competition around that, and I was so amazed to see how much people were gushing about their toilets. I mean, something that you and I wouldn't even think of. But so many houses which were kacha, semi-pakka, but with very, very pakka and very well finished toilets. It was such a pleasure. I had an architect who came to, judge the competition. There was a whole lot of, we had competitions around rangoli, decorating the toilet, drawing competitions by children, and using World Toilet Day as a theme. And you should have seen she was, she's working in commercial sector of architecture, but when she came as a judge, she was blown over by the kind of imagination and the kind of response that we got, today in the settlement. So I just think as architects, just be open to working in the development sector, and you might just find that, a whole new world would open up for you if you decide to spend some time exploring.
Absolutely. It is such a heartwarming anecdote, actually, and it is so nice to see the kind of change that is coming about. So I'm sure a lot of students, architects are going to go from this talk inspired and more conscious, definitely. And it is wonderful to hear about your journey as well. So I think with that, we can conclude this thought-provoking session. Thank you, Architect Pratima Joshi, for taking out time from your busy schedule to introduce the audience to your research and process, which highlighted how public infrastructure should be conceptualized in cities and respond to the context and neighborhoods they are inhabiting. I'm sure the listeners have a lot to think about after your presentation and the following Q&A session. If you have anything that you would like to say to the listeners.
Well, I would just like to thank all of you for patiently not only listening to the presentation, but also, listening to the Q&A and tolerating me for the last 1 hour, I think. But I really would like to thank ASH for giving me this opportunity because, these are platforms that I always say yes to because this is my only connection with my fraternity, and I deeply appreciate and look forward to it. So thank you so much, Geeta, for again giving me this opportunity to connect with all of you. Thanks a lot.
We are extremely glad to have you here as well, ma'am. And so next month, we will be celebrating World Civil Aviation Day for all the listeners as well. Keep in tune with the happenings of the future events on Ethos and Glass Academy's website. Thank you again, Architect Pratima, and thank you everyone for joining in. Have a great evening.
Yeah, thank you.
Hello? Cobra? Hello? Cobra? Hello? Hello?